So it's been a year since our first lockdown started. One of the more heartening moments of the past 12 months was seeing the extraordinary goodwill and kindness as business, government and ordinary South Africans pulled together to help those hardest hit by the pandemic and the economic fallout of the lockdowns. The Solidarity Fund, established to help government deal with the crisis, has raised over 3 billion rand in pledges in the past year. Now it's focused on our vaccine program. And to tell us more, I'm joined by the head of disbursements and deployments at the Solidarity Fund, Nicola Galombik. Nicola, thank you so much for joining us. Just first, if we look back on the last year and the work that the Solidarity Fund has done, what is the fund most pleased with regarding how funds were utilised?
Good evening, Sally. I think the thing that heartens us most is that we've been able to respond to what's most needed at the time when it was needed. Whether that was strengthening the health system, in time to deal with the sort of excess strain on the system through the provision of ventilators and essential equipment and PPE, whether it was be able to respond to the dire needs of citizens for food relief during the extreme lockdowns, and some of the sort of adverse consequences in terms of gender-based violence. And also just, our ongoing campaign to mobilize citizens to exercise preventative behaviors, because in the end, a lot of the management of this pandemic comes down to each and every one of us and our acts of solidarity by wearing our masks and, avoiding indoor events and also, being kind to fellow citizens and being empathetic. So I think we are, very proud of this past year and all that we've been able to do, but also very fired up about the role we need to continue to play, particularly as we roll out the vaccines.
Well, it's interesting that you say is that what the Solidarity Fund has concentrated on is trying to meet the need as it arises. And the obsession, of course, is our vaccine rollout program. We know that we now have about 300,000 Johnson & Johnson vaccines, 220 odd have been administered. That isn't even part of the official rollout because, of course, that will kick in with phase 2. But the priority now is to get those jabs into the arms of our healthcare workers. I know that the Solidarity Fund has pledged funds, has given money towards some of those vaccines. Just explain to us what you've given, how it's working and how you're intersecting with what government is doing.
Well, so the whole vaccine program is led by the National Department of Health, and the Solidarity Fund really is playing a role to augment and support the national effort. Our first intervention in respect of the vaccine program was at the end of last year when we made a down payment for the COVAX program and were able to just help the country trigger that first entry into the vaccine procurement process. We also were able to step in to help fund the eNCA program that you were referring to, which is an implementation study to roll out J&J vaccines to our health workers ahead of a potential third wave and winter. And we are now very much focused on the large-scale rollouts to the broader citizenry in phases 2 and 3 of the campaign. And they're really, the big challenges are a very rapid and large-scale scale-up of delivery platforms. We're going to need additional vaccine sites. We're going to need additional human resources. We're going to need additional cold chain equipment. And the Solidarity Fund, will work with and is working with the Department of Health and also with business and other civil society organizations to ensure that we have a sort of single national plan and a really mobilized national effort that is coordinated and that can get us to a point where we can implement really fast.
This is the thing, we've got to scale up. Government has already missed one deadline. We know that it is an absolute bun fight globally to get vaccines. The technical support that you're offering, does that include obviously a lot of funds to get those sites up and running as quickly as possible? And then the second part of my question is, are you confident we can do it? Because we've missed a first series of deadlines already.
So, I mean, I think, the Solidarity Fund is not directly involved in the procurement of the vaccines themselves. I mean, I think that we are aware, though, of the progress being made in that regard. And I think we are going to see the vaccines coming in now and certainly ramping up towards the May, June and July, when we're going to, I think, see a very large number of vaccines coming into the country. And what we then need to be ready to do is be able to administer those vaccines to as many people as possible, as quickly as possible. And for that, as I say, we are already planning. There's planning underway for mass vaccination sites, for increasing the capacity of existing sites in the public and the private sector, and in mobilizing civil society to drive registration of citizens. And we really are going to need a national mobilization because, in a sense, while we've been slow to bring vaccines into the country up front, when they do come in, we need to administer them as quickly as possible.
Yes, we absolutely do. Well, thank you so much. It's good to hear the Solidarity Fund is on board for this next phase of challenges as we fight the COVID-19 pandemic. That was Head of Disbursements and Deployments at the Solidarity Fund, Nicola Galombik.